with a very severe earwax infection in this their right ear, and they also had a bacterial ear infection in their left ear, known as swimmer's ear. And in fact, it was the left ear why they attended, and I treated the left ear first when the patient did attend, but for the purpose of this video, I'm just showing you in reverse order. So they weren't even aware that this ear was blocked because their left one was so infected. But as you can see, this patient's got really dark, dry, crumbly wax occluding the entire ear canal, right from the entrance all the way to their eardrum. Because of the consistency of the earwax, I'm just currently using the new right ear hook. So this ear hook differs slightly towards a traditional ear hook I used to previously use, the same parts ear hook, in that the tip is more tapered, so it's got more of a narrowed and sharper tip, which allows me to embed into the wax and almost chisel it. I found the other previous ear hook I used to use a bit blunt at the tip, so sometimes I would struggle to embed it like I am here. Now, although the ear hook isn't always necessarily bringing the wax out, it is chiseling it into little pieces, and that will I can then use the microsuction probe to suction up any of these loose, crumbly bits. And I'm also going to use the new ear pick a bit later on in the procedure. So you can see here I've just reverted to the microsuction probe to suction some of these loose segments. Now, guys, I mentioned it in on my other video that I uploaded this evening on my Clearwax YouTube channel, and also on Facebook and Instagram and TikTok. Unfortunately, there's been a big spike over the last month, I think, and it's some other colleagues who post online have also mentioned it to me. And the spike is in people who have just been really, really silly and acting immature and being ignorant and leaving silly, nasty comments, not only to myself but also to each other. I gave an example in the other video I uploaded today. Someone was wishing another viewer diarrhea on Christmas Day, and I just think, come on, guys, we're meant to be. I mean, I'm assuming that person is an adult, but they sure weren't acting like one. It's very childish, idiotic behaviour. I just think a lot of people are really entitled as well, because when I'm uploading these videos, guys, it's not for entertainment. Some people may find it entertaining, and that's fine, but that's not why I'm uploading it. This is an actual medical healthcare procedure that I'm performing on a real patient. So when some people leave some comments like, you're too close, or you're too far, and you don't know what you're doing, you don't like it because I'm using this instrument, or you don't like it I'm using that, and why don't I do this, and why don't I do that? Guys, this is not for entertainment, this is a real patient. There's one particular incident just before Christmas. Someone was really nasty and spouting off what I should and shouldn't be doing, to the point where I believe there must have been a specialist. So I asked the individual, well, what do you actually do? What's your profession? Are you an ENT or an audiologist? And he said, no, he's a delivery driver. So I'm getting told what to do by someone who's got no experience whatsoever with ears, other than owning two ears himself. I mean, I'm not a HGV driver, and I gave this example in the earlier video, so I'm not going to start giving critiques to someone in a profession that I don't know what they're doing, because it's not I'm not trained or a professional in that arena. So, guys, it's a bit insulting and immature when I'm getting critiqued and being told what to do by people who've got no idea, but haven't got the foggiest of what's going on and how complex this procedure is. I mean, I have some videos, ENT consultants complimenting the work I'm doing, and then I'm getting a delivery driver who's never, and I'm just giving that example just so it's their profession. I've got nothing against delivery drivers. I mean, I don't know how to drive a van, so I'm going to start telling you how to drive a delivery van. It's a very skillful job to do. But I'm getting these individuals then telling me that I'm doing it wrong. I've got an ENT consultant, surgeon telling me, I'm doing it very wrong indeed, and they were very impressed. So guys, just give it a break. I mean, it's coming to the point where I may start to send comments again, because I don't want to be exposed to that. This is an earwax on the channel, and there's so much hatred out there in the world. It's quite sad, and I think people leaving these comments, they must have some sort of void in their life. And I don't know how some of these people can be nasty on a day-to-day basis. It's some sort of thrill out of it. It's a horrible way to live, guys. So if you're not one of those people, stop being mean to myself and stop being mean to the viewers. People just want to enjoy the content. If you don't enjoy it, fine, no one's forcing you to watch it. So I don't want to dwell on that too much because it's a new year, but I just thought I'll set the tone for this year and we'll see how it goes. But if it does continue, then I'm just going to disable the comments. And it's a shame because it's only a small minority, but I don't want to wake up in the morning and get all these alerts and all these comments on my phone. It's just not right. It shouldn't be like that. So, okay, let's continue with the video. So I've got the outer half out, and then we've got this medial fade. You can see it's quite matted. There's a few hairs there, so I did ask the patient whether they're poking inside their ears. They said no, so it could also be when this patient has a trim of their beard, or when they go to the barber, some of these hairs can fly loose inside the ear. And I sometimes have a few hairs in my ears after I go to the barbers. You can see there's a slight sore spot just on the right. There's a bit of a adhered wax and coat, no removed there. You can see it's just slightly blistered. It's the right hand side canal wall. Now, I was contemplating using some olive oil spray just to soften this, but the patient wears hearing aids and they weren't wearing it in their left ear because it was infected, so I wanted to avoid it because if a patient's wearing hearing aids and we put one in, there's always, obviously we try and mop as much oil off as we can, but it just makes the ear really greasy, and that can sometimes weaken the retention of the hearing aid. But also sometimes that oil, as it's draining back out the ear, it can enter the hearing aid itself and affect the electronics, so I just wanted to avoid it. So you can see the anterior aspect of the eardrum, the anterior quadrant, and just peeling this off, you can see it's almost like caramel, this section, it's sticky. We're nearly there. Truth be told, we could have left that, but this patient's really still. I felt quite comfortable removing this with a fine end, so it's going to peel this away. So this is the attic region, or just to the side of the attic actually. You can see the short process of the malleus. So just to the left, that spherical ball, that's known as the short process of the malleus, also known as the lateral. It's got two names, the short process or lateral process. So this is the tip of the hammer bone. So peel that, so it's got quite a curved ear, quite a prominent anterior recess, so probably with a wax scope or the ENT microscope, or head-borne microscopes, we wouldn't see the right section of the eardrum there. It would be quite difficult to, because of how bendy the patient's ear canal is and how prominent that anterior recess of the crevice to the right is. Dry skin there. Hair strands, so I can peel that one. On the now you can probably see the boundary. We're on the cartilage portion here, that the skin is a bit paler in complexion, a bit thicker, whereas the skin that lines the bony part of the ear canal, it's more red, and that's because the skin that lines the bony part of the ear canal is extremely thin, less than 0.1 mm in thickness. So all the blood vessels and capillaries underneath are more visible, whereas on the cartilage portion, the skin's a lot thicker. It's 1 mm in thickness, so the blood vessels are 1 mm sub the epidermis layer of skin, which is the outermost layer of skin. So you get a paler complexion. And of course, when you've got a thin layer of skin around the bone, the bone's texture makes the appearance quite glossy, whereas the cartilage, which is the outer third, it gives you that more matte appearance. So this is their left ear, this is the ear they're attended with. Now, the ear is actually, there's no occluding debris. You can see the eardrum, but this patient's got all this ottery, which is the medical term for discharge in the ear. They have been prescribed some medication by their GP, but the GP recommended they try and get this excess debris cleared first. So it then allows topical antibiotics to really penetrate the epidermis layer of skin underneath this. Sometimes when you've got a lot of discharge like this and you use topical antibiotics, it sits on the surface, so there still can be a hidden infection underneath this. Where possible, good to peel this away. Now, it's not always possible to do, it is quite complex, and I know a lot of audiologists, in fact, I uploaded the video about the canal pressure 10 minutes my last one on a professional platform, LinkedIn, and a fellow audiologist was very surprised that I was removing all that debris, and that's for the reason they wouldn't have attempted that. They would have just referred to the GP and asked the patient to use the drops. And again, that's to give you an example, guys, when people sometimes try and critique. And we've got colleagues who wouldn't accept the procedures that I'm doing, and then to be critiqued by someone who's got no experience. It's just a bit silly, and just a lack of intellect on behalf of the person making these comments. So you can see the top part of the ear is very inflamed. There's a lot of erythema, so redness. There might be some granulation tissue, memory sometimes, as you see. So I'm just kissing the surface of the eardrum here. Now, believe it or not, it's made a big difference to the patient's hearing. They felt they could hear significantly better. Yeah, so just some granulation tissue posteriorly to the back section of the eardrum. And not only were they able to hear better, once I removed everything, so at this stage they still felt they could hear a bit better compared to when they came in, but when I cleared all this, you can see all this ottery that's around the canal wall, it really helped their hearing. So, and that's because the sound waves are better able to travel through the ear canal to vibrate against the eardrum. We've got discharge like this, it will of course absorb some of the sound waves, so it will reduce the amplitude and intensity of the sound. So just be gentle, there's a bit of edema and swelling there as well. And these are not procedures. When I first started, there's no way I would attempt procedures like this. So again, it does take practice and experience and to feel comfortable to do procedures like this. But at first, like the colleague that I mentioned, I would have just referred this patient, I would have advised the patient to either go somewhere else and see a surgeon, or just start using the antibiotics, and hopefully it will resolve the infection. Now, how did this infection occur? Now, this patient underwent ear irrigation, but they did it themselves. So they did have some wax in here, they said, and they went online and they purchased hydrogen peroxide drops. So what hydrogen peroxide drops do, they're water-based, they're alkaline in pH, and the hydrogen peroxide, when it enters the ear, it reacts with an enzyme that's secreted by one of the glands down at the third, the somunous glands. They're modified sweat glands. The proper name is apocrine glands. So the same sweat glands found under your armpits and in the groin region, and they secrete an oily sweat called cerumen. So it's different to the sweat you find on the ground, which is more watery and salty. This is more of an oily sweat. But this gland also secretes an enzyme called peroxidase. So when the hydrogen peroxide enters the ear, it reacts with peroxidase enzyme, and we get a transformation. The hydrogen peroxide turns into water and also into oxygen, and during that transition from liquid to oxygen, so during that change, you get effervescence, you get a bubbling, mechanical bubbling, and it's believed that the bubbling action will help to break up the wax plug. Some of the hydrogen peroxide drops also contain urea. So urea is, again, it's sort of a lipid secretion, but it's known as a keratinotic. So keratin is a protein found in dead skin. Urea can help break down keratin. So again, it can help to break down the wax plug. Problem with hydrogen peroxide, though, when a patient attends with hydrogen peroxide drops in their ears, it's always a complex task because it, more often than not, changes the consistency of the wax plug into a mushy, wet mud consistency. So it's very difficult to suction and clear because it can keep blocking the suction probe. It doesn't come out in lumps, it comes out in little bits. It just makes it really, really difficult to perform a procedure when a patient uses hydrogen peroxide drops excessively. Now, when you get water in the ear, and also when you use hydrogen peroxide, there's always a risk of increasing the pH level of the ear. So water is more neutral, hydrogen peroxide drops are more alkaline, and our ears are mildly acidic, and when the ear is mildly acidic, it keeps certain bacteria and fungi in the ear non-pathogenic. So we've got resident native bacteria and fungi that actually reside in the ear. We call it skin flora. Wouldn't quite call it a symbiotic relationship because the ear canal doesn't really benefit from the presence of these bacteria and fungi, but the bacteria and fungi benefit because the ear canal provides it shelter and food. But under these mildly acidic conditions and dry conditions, many of the bacteria that are native to the ear canal, to the skin flora, and also the fungi, are non-pathogenic. They don't do any harm to the ear canal. However, when the pH level increases, the bacteria in particularly are what we call neutrophiles. They're most at their optimal growth activity when the pH is more neutral. So by introducing water and hydrogen peroxide in the ear, you're going to increase the pH from a mildly acidic condition to more an alkaline and neutral, which then gives these bacteria an opportunity to flourish and really exponentially grow and reproduce. And a couple of these native bacteria can then become pathogenic, so it can lead to an infection. But it also then allows external bacteria that may enter the ear, and some of this, quite often water contains some of these bacteria, to then, which wouldn't otherwise be in the ear. It gives them the perfect breeding ground to then also reproduce and grow and lead to an infection. Fungi are less susceptible to changes in pH, but they're more susceptible, I would say, to whether there's humidity in the ear, so warmth. So warmth and humidity will allow the perfect breeding grounds of fungi. But a lot of the fungi that leads to ear infections, so aspergillus, candida, they are. Most of our ears have these fungi, and they're native to the ear, but it's just when the conditions change, it gives prominence to these fungi to then cause harm and become pathogenic. And this is why I myself personally am not a big fan of ear irrigation. I know a lot of people perform it, and I mean, in the UK up until recently, GP practices in primary care, that was the main treatment given. But there are a lot more contraindications, so there's a lot more on tick list where you can't perform it. Also, there's more increased risk. Now, there's also risk involved in microsuction and mechanical removal of earwax, but the significantly increase, I would say, when you use water irrigation. So, although there's a lot of specialists that perform it, because I feel comfortable not resorting to it, then I wouldn't resort to it for that reason, because I'm comfortable removing wax debris. I mean, you wouldn't be able to perform irrigation in this ear anyway at this stage, because that's one of the complications. When your ear is infected, you should keep the ear completely dry. Introducing water in this ear will only exacerbate this infection and make it worse. In terms of ENT in the UK, do they perform irrigation? I've never personally come across an ENT myself perform irrigation. There might be some ENT that don't, but generally speaking, it's not something that's performed by ENT for the reasons I've described, because you're just potentially increasing the risk of a patient developing an ear infection. Now, if you get, some studies say 3 to 5 out of 100, some of the studies it's 3 to 5 out of 1,000. So there's some discrepancy there, but anecdotally, from what I see, I would probably say it's probably in that first region of 5 out of every 100. But again, that's anecdotal. There needs to be some more in-depth research, I think, looking at the prevalence of the side effects and infection caused by irrigation. But I think in part the ear's been dried. So but we have some guidelines called NICE guidelines, I think it's abbreviated for short for the National Institute of Clinical Excellence, and you get leading figures in the field of, obviously in this case, the ENT, and they look at all the peer-reviewed evidence. And so ear irrigation is part of the NICE guidelines. So ear syringing is not. So syringing and irrigation are two different things. So syringing in the UK, at least, that term refers to when the old-fashioned metal syringe, when a doctor and nurse would literally pump quite a big metal syringe into the ear, exert a lot of pressure. So that's banned in the UK. Now I know in the US that's still used, and the reason why I know that, well, it was probably back in 2015 when I visited America, went to a couple of conferences back-to-back summers, and I actually saw these metal syringes being sold at exhibition stands at these conferences, and I was really surprised. But in the UK it's banned. Now, irrigation is slightly different. So irrigation, if you go to the dentist and you get the dentist and the dental hygienist, they rinse your mouth out, they use an irrigation pump. And in fact, the first ear irrigation was performed using a dental irrigation pump by a nurse, and then obviously it got modified into an ear irrigation machine. And that's where water is more pumped into the ear, more controllable flow and pressure. You still can go gung-ho if you wish, but there's an adjustment on there, either a foot pedal or a dial, a switch where you can regulate the pressure. And typically with the irrigation, you want to aim the nozzle at the roof of the ear canal. And the concept is this water runs down the ear canal up against the eardrum on its way back out. So you can imagine the vortex that it creates, it flushes out tips with any wax that's in the ear canal. So when patients have had this performed, the ear should be dried afterwards. That's part of the NICE guidelines, that's why I made reference to it. So they do recommend drying the ear. So how do you dry the ear? So you can put swabs in the ear, but sometimes they can be uncomfortable. As audiologists, we have access to what we call auto blocks, which are more spongy foam blocks. We normally put it in the ear when we take an impression, so a cast of the ear. So we put this little foam stopper in the ear. There's a string attached that then hangs out of the ear itself. And we make sure that auto block, we call it, that foam sponge, it creates a complete seal around the ear canal. And then we inject some putty material to take the shape, so similar to what dentists use to take dental impressions, and then we allow that material to set. And once it's set, we can pull the impression out, and alongside it, the auto block, that foam sponge comes out of the ear, and if not, we've got the string to help us pull it out. So that can absorb moisture in the ear. A lot of ENT would recommend a solution of 1 part rubbing alcohol and 1 part